Mr. Bill Gates, the question here is also, the last time we met at a breakfast meeting with some ministers of the Indian government with you, and you were talking a lot about the kind of data that the Indian government has, and data that actually connects people to the needy people, the welfare state, and how there is a whole model that works on the data availability and connecting people to the needs. How do you think India is doing in that direction in terms of reaching the last mile to the last needy person in a welfare state?
Well, the ultimate test in the world of health is to look at a number of the deaths. I mean, it's tragic stuff, but to look into it and figure out, okay, what was the cause of that? Is it diarrhea? Okay, do we need a vaccine, or is that, better sanitation? Was it pneumonia? Okay, did they get the vaccine? And so this idea of really understanding those deaths, which there's a lot of researchers, some of whom we give grants to, that's guiding the priority. India in general has very high vaccination coverage, and there are parts of the country where it's not as high. India manages at the federal level to provide more resources to the poorer states, and that, I've seen that's being applied now to improve the quality of these health services. So that constant feedback loop, yes, there is an awareness, Are we Kala-Azar? Are we near to eradication? No. Okay, it's still in these few places. What do we need to do there? There's these so-called neglected diseases where we do these mass campaigns, and the coverage levels of those drugs wasn't high in some places. And so now we've seen that, and the government's driving the quality there. So, you have to be constantly learning. When the things don't go well, you have to kind of say, okay, how do we adjust that? And, health in India is on that learning curve.
Let me also ask you, you often talk about the fact that climate change is not something businesses are talking a lot about. And, with profits needs to come in a little bit of responsibility and accountability. Do you think climate change and the health indices of human beings across the world are connected? And is there enough that is being done in that direction?
Yeah, so the data in our report, I'd say, is one of the first times that you're really seeing a serious numerical analysis. You might think, okay, everybody's going to die, or that it's not a big deal. And here we're providing, a real model that connects the temperature to these health outcomes. Climate change, we need a lot of innovation. Today there's a lot of activities, cars, buses, making cement, making steel. And through innovation, we need the price of that, the clean approach, to get below the dirty approach. And so I fund a lot of that kind of work. As we make progress on that, India will be a very important place to scale that up. And so I'm often talking to partners about, okay, what does this look like? Tata's in the steel business, Reliance is in the solar panel business. So we're going to get to a stage where even beyond building solar fields, India has to participate in this green industrial revolution.